Terminology allergy is derived from which word? It came from Greek. You teaching a group of grade school children about the body function. A student asks, why I do sneezing? What are the nurse response? Sneezing is a protective mechanism, right? So response is sneezing is your body a way of getting rid of something irritating. The nurse is planning care for a client with the allergies who has an order for a symptomatic drugs. The nurse is aware that desired effect of this client is allergics, right? Our patient, give them symptomatic drugs. What is our desired effect? To relieve the stiffness because allergic rhinitis. Which assessment data would provide the nurse with the best evidence of allergic rhinitis? So assessment data, best evidence allergic rhinitis. Which sign and symptom is most common? Coughing, sneezing, and watery eye. It is the typical presentation of allergic rhinitis patient. A nurse is administered an antihistamine to a client with a nasal allergies. So antihistamine for nasal allergies. The nurse aware that antihistamine have which distinct limitation. They are most effective when taken prophylactically. So before attack, if you take, you can get the best response. The nurse is teaching a client about the use of antihistamine for allergic rhinitis, which pointer is appropriate for increasing the effectiveness. So you prescribe antihistamine for allergic rhinitis. So appropriate increasing effectiveness. Take these drugs before you are exposed to the allergens. Like the previous question we found, they are most effective when you take prophylactically, means take this medication before you expose to the allergen, like a vaccine. Patient with allergic rhinitis may benefit from prescription of what? Antihistamine like cetirizine, steroid if allergy is too much, fluticasone, or chromoline nasal spray over the counter we can buy. So all of them can be prescribed. A patient, Howard, is a 70 years old and he's a man. Occasionally take antihistamine diphenhydramine for seasonal allergic. Monitoring for this patient taking diphenhydramine would include assessment for what? Antihistamine can cause Urinary retention can cause dizziness, confusion, right? It is the side effect. The first generation antihistamine, such as loratadine or cetirizine, prescribed for the seasonal allergy because of less sedation than the other first generation antihistamine, right? So when we prescribe antihistamine, we could educate our patient to take some precursor before to drive, to deal with heavy machineries, right?